The first of our three speakers will continue the discussion that we had last year, looking at public perception. Dr. Cynthia English is with us, and she's a client service consultant with Gallup. She advises on research design for many of Gallup's key domestic and international studies, developing content for hundreds of qualitative and quantitative research studies each year. She has served as a research director for the United Kingdom and Germany Gallup daily tracking polls from 2010 to 2012. Her primary research areas include press freedom, international relations, education, poverty, well-being, and youth development. Ms. English has published more than 80 articles on Gallup.com and authored numerous research reports for Gallup. She has co-authored several conference papers presented in Europe, Africa, and the Middle East, as well as the United States. Her expertise includes survey research design, qualitative research design, quantitative research design, communications, cross-cultural and cross-national research studies for public and nonprofit sectors, international and cultural policy. She'll be speaking this morning on Gaining Momentum, Gallup-Palmer Report, Year 2 findings, and it is my absolute pleasure to welcome to the Palmer podium Ms. Cynthia English.
Thank you very much. I'm so excited to be back this year to address the Palmer Homecoming crowd. It was one of my highlights of my year last year to be here and get to talk about this research. And I have a lot to show you this morning, so I'm going to try to move through this presentation at a pretty steady pace. But I want you to know that in a couple of weeks we're going to release a report that has all of this data in there, that you'll be able to kind of take more time to go through it and really dig into the data. But first I want to give a couple of thank yous out to some of the Palmer College leaders that I've had the opportunity to work with. First of all, I just want to thank Vicki Palmer and the Palmer family for their support of this project. We could not be doing this work without them, so thank you so much. And to the Board of Trustees, led by Dr. Trevor Ireland and so many other wonderful leaders that I've had the opportunity to interact with over the last couple of years on this project. I've learned so much from them, not just about the chiropractic profession, but also just about the issues that matter to your patients as well. So thank you to that group. Chancellor Mark Yorey and Jim O'Connor have been my kind of partners in crime and key contacts here over the last couple of years. So a special thank you to them for partnering with Gallup and with myself on this research. One kind of logistical note before we get started. You are the first audience to really see this data. I presented it in small groups to the Palmer leadership. But you're really the first. And it's more of a sneak peek. This is not a public release or launch of the data. So we ask that you do not tweet or put out on social media any of the actual data points, just because we're waiting to do that launch in about 2 weeks' time, at which point everything will be publicly released and available. Of course, you're encouraged to tweet about Palmer Homecoming. You can mention the presentation. You can talk about anything you want related to kind of the general content, but we don't want you to actually put data in there. So thank you very much for that. So this morning, this is, as Denny mentioned, this is the second annual study that Gallup and Palmer have done together on the Americans' perceptions of chiropractic. Last year was really a foundation laying year. There's a lot of research out there, has come out kind of piecemeal over the last few decades about chiropractic. Some were about perceptions, some were about experiences that patients are having, but there really wasn't an opportunity to see how attitudes among the general population were changing over time. And that's one of the big advantages of this project, is really setting a foundation in year 1 and now coming back in year 2 and assessing, has anything changed? And really we have the opportunity this year to dig deeper into some of the concepts that we looked at last year. So there's a lot of rich data. We're really focused on answering 3 research questions this year, and this is what the presentation will focus on. Do Americans view chiropractic as safe and effective treatment? We got some idea of that last year, that in general there were positive perceptions, And those that weren't positive were often unsure. They just didn't have enough information about the profession and what care involved to make an assessment. There was only a small minority of about 10% of adults in the US that had an outright negative view of chiropractic. So that was, I think, encouraging for all of you to know where you stood among the adult population in the US. So this year we're going to look at how chiropractic is perceived in relation to other treatment options that people have. With that, we were able to ask people not just about chiropractic care, but about physical therapy, prescription pain medication, back surgery, and I think self-care and a few other things. So we were able to really assess how they feel about chiropractic in relation to those. The second area we looked at was how to unpack the uncertainty that some people in the population feel about chiropractic. When we ask them questions about it, there's always a group. Sometimes it's about 20%, sometimes it's as many as 40% of adults in the US that will tell us, I don't know how I feel about chiropractic, or I don't know how safe it is. So we really want to unpack that group and understand how do we get them information and educate them so that they can understand more about it. And really that education is really key. So we're going to learn about the major barriers for people who tell us they don't plan on going to a chiropractor. This year we asked them why, to give us the reasons so that we could better understand that in the research. And last year we found that our respondents that knew more about the chiropractic profession, that knew how many years of education you've all put into it or are in the process of putting into it, the people that understand that background don't have concerns about chiropractic safety, and they're more likely to say it's effective. So educating the public about your education is definitely a key learning from last year. So we'll dig deeper into that today and explore about what some of those respondents need. We also looked at patients, and we went in depth this year on what patients want from the chiropractic experience. Beyond getting an adjustment and having it be an effective treatment method, what other things are patients looking for, and what advantages are there for the profession when patients get what they want. Okay, a very little bit about the methodology because we don't have a lot of time. This year, this is a nationally representative survey, and we have this year over 7,600 respondents to look at in the data. We did use the Gallup panel, which is a nationally representative, probability-based panel of over 100,000 adults. And we selected a sample to participate in this study last year. This year we selected a different group. So this is not a longitudinal study where we track the same people over time. It's a brand new group, still representative of the US adult population, 18 and older. We used web and mail surveys, and we positioned the survey the same exact way this year as last year as a wellness survey. So we didn't tell people this is going to be about chiropractic. We positioned it as more of a general wellness. Our margin of error is 1.8, so in some cases, if you were really paying attention last year, you might notice a couple of numbers moved a little bit, but if they're within the margin of error, it's considered the same. And we did this in February and March. I'm going to start and end with this data. So one of the things we wanted to have the ability to do in our analysis was look at people who were actually experiencing significant back and neck pain with those that weren't. Because for the chiropractic profession, those are where most patients start their chiropractic journey, as they come in with some type of spine issue, most likely causing them pain. So we wanted to be able to separate out those people in our sample from those who hadn't experienced that yet, and learn a little bit more about the things that they're saying. Of course, there's been lots of data done, good data on the prevalence of back and neck pain in the US, but for our purposes, we really wanted to know not only who are the people experiencing significant neck or back pain, but we wanted them to be the people who also went and received care from a healthcare professional. Could have been any type of healthcare professional. So looking at this data, we were able to find out who are really those. This is the biggest opportunity for the chiropractic profession, is to capture that audience. If we had a smaller room and more time, I would ask you to guess how many adults in the US said that in the last year they had back and neck pain significant enough that they sought a healthcare professional for care. And you can probably pick a number in your head. How many adults in the US do you think went through that? And you might be close to this number, you might be way off. But what we found is that 1 in 4 adults in the US say that they had back and neck pain significant enough that they sought a healthcare professional for care in the last year. 25%. So that represents obviously millions and millions of people. And towards the end of the presentation, I'll let you know how many of these people actually saw a chiropractor, because I know you're probably wondering. Just to break down the numbers very briefly, about 11% of adults had that kind of pain in the last 4 weeks, so it's a very recent pain. And another 14% said it's been between 4 weeks and a year since I've had that pain. This group at the bottom, 35% of adults in the US say they've never had back and neck pain significant enough where they sought healthcare professional for treatment. So that's mostly young people if you look at that group. And we'll talk a little bit more about this data later on in the presentation, as I said. But this is really the lay of the land in terms of Americans' back and neck pain. So one of the very first things we asked our respondents about was perceptions about the effectiveness of different treatment options. And we did this really close to the front of the survey. We didn't want to ask them a lot of chiropractic questions and then say, well, how effective do you think this is? So we started out and we gave them several different treatment options for them to essentially rate on the level of effectiveness. So the way we asked the question is really important to make sure that we were setting it up in a very objective way. So we asked, people have different ways they can treat neck or back pain with the help of a healthcare professional. For the following questions, please assume the pain is significant enough that you need to see a healthcare professional. Please indicate how effective you think each of the following are in treating that kind of neck or back pain. We specifically made it about neck or back pain because it's a little too broad in general to say, well, how effective is this treatment option in general? We wanted to make it specific to a certain kind of issue. So I have a couple of slides that look like this, and I'll kind of help walk you through it. On the left-hand side are the different treatment options we asked people to rate. Physical therapy, chiropractic care, prescription pain medication, back surgery, and self-care. Because we all know most people start with self-care and wait until it gets bad before they reach out to a healthcare professional. And this was asked of everybody, not just people who had back pain, not just people who saw these professionals. It was representative of the whole US adult population. So the first data point are the percent of people that rated each of these treatment options as very effective for addressing significant back and neck pain. So you'll see that physical therapy at the top, about 41% of adults would say that that's very effective. And just a quick note about all of these, this isn't about the practitioners, because physical therapy is something people can get from their medical doctor, a physical therapist. Chiropractors will often give people physical therapy exercises to do and things like that. So it's actually about the treatment method, not the practitioner. So 41% say physical therapy is very effective, 29% say chiropractic care is, and you can see the data on the other items. Only 15% say that back surgery is effective. And it's certainly the most invasive of the ways that they could treat this. The next line represents people who say somewhat effective. If you look at the chiropractic care line there, the second from the top, you'll see that it adds up to about 70, my math will be off, so maybe 77% of adults in the US, whether they've gone to a chiropractor or not, whether they've had back pain or not, say that chiropractic care is either very effective or somewhat effective way of treating back and neck pain. The number on the far right, the 19% on the chiropractic care line, these are the people that say, I don't know. I don't know how chiropractic care, whether it's effective or not for treating back and neck pain. And this is very consistent with last year, where we had about 20% of people say, I just don't know enough about this. And you can see towards the bottom, the second line from the top, a lot of people don't know if back surgery is also effective or not. So there's just uncertainty among this group. Breaking down the data a little bit, this top line that's in the green bar represents people who've actually been to a chiropractor in the last 5 years. So this is the group that's had the most personal experience with chiropractic care. So when we ask them how effective is chiropractic care, 6 in 10 of them describe it as very effective, the people who have actually been treated by a chiropractor. And it's much lower for people who've never been to a chiropractor, that's at the bottom, or those that went but it's been more than 5 years. So the patients are experiencing and rating chiropractic care as very effective. The rest of them are saying it's somewhat effective. So you have very few people who are saying it's not effective among recent chiropractic users. And very few people obviously don't know because they've personally experienced it. So similar to last year, the more recent that somebody has experienced chiropractic care, the more positive they rate it, even if they're not currently under care. This was just a quick little tidbit about chiropractic users. They're less likely than non-users or people who just haven't been in a while to say that prescription pain medication is very effective. And that's the green data there. So perhaps they tried it and didn't work for them. It's hard to say what their reasons are, but there was an interesting difference among that group. Now we want to look at people's perceptions of safety of different treatment options. And for this one, we wanted to be sure to position the question in a very honest way. So all treatment methods carry some level of risk for a patient. So we established that. And I want to thank Dr. Weeks, who's in the audience as well, for his just great advice and guidance on these questions and how we worded them. He definitely brought a lot of expertise to that this year, which we appreciated. So then we said, well, please indicate how safe you think each of the following is for patients. And again, it's the same kind of design. This is the percent, and there's the chiropractic line to keep your eye on. But this is the percent of people that said each of these treatment options are very safe. That's the highest level. And they could say somewhat safe, not safe at all. So there were a couple different ways. So physical therapy, again, is at the top. Just over 2/3 of US adults describing physical therapy as very safe, which again is about the actual treatment of physical therapy that they may be getting from a variety of sources. Chiropractic care, about 1/3 of all adults described it as very safe. And prescription pain medication, back surgery, and over-the-counter pain medication you can see is rated lower on safety. So while of course as chiropractors you would like to see the number higher, you'd like to see it higher than physical therapy, I think it's definitely worth noting that adults in the US are more likely to describe chiropractic care as very effective and very safe than say this about prescription pain medication or back surgery. So there's definitely an advantage in perceptions over those methods for chiropractic care. One thing to note on the very right, that darkest gray, that's the people who say they don't know. And again, you have about 12% of adults in the US that don't know how safe chiropractic care is or whether it's safe. And you see that same level of uncertainty related to back surgery, but not the other treatment options. So there's really an opportunity there to educate people about the chiropractic profession and move them from uncertain to hopefully perceiving it to be safe. That's going to be a running theme today, is how can the profession educate more people about what chiropractic care is, the training involved, and then statistics about safety and effectiveness as well. Because when people know that, we can see in our data when they're more informed, they're more likely to perceive chiropractic care as positive. 1 in 5 adults who have never been to a chiropractor just don't know whether it's safe or not. And that's that top group, I've never been. If you look all the way to the right, 21%. So this is kind of what I'm talking about. These people have never gone, so they haven't had their own experience. And 1 in 5 of them just don't know if chiropractic care is safe. Just a quick tidbit about prescription pain medication. Again, we learned a little bit earlier that chiropractic patients are less likely to feel that it's effective. Younger people are also more likely to question the safety of prescription pain medication. There could be a lot of reasons for this. There's certainly been a lot of visibility in the media related to prescription pain medication addictions and overdoses. This survey was done before the death of Prince, so we don't have a Prince effect here. It's probably even higher among all people really who learned about the specifics of that. But definitely an interesting trend as people have become younger in the US, they're more likely to question the safety of prescription pain medication, and presumably more open to alternative treatment options when they have pain. Moving on now, this is one of my favorite questions because I think it's the best information we have about the future. We asked this series of questions last year as well, but we wanted to understand, under certain conditions, how likely are people to say that they would go see a chiropractor, whether they have ever been to one or not. We approached this 2 different ways. The first one was to present a hypothetical situation. Suppose you were experiencing neck or back pain and wanted to see a healthcare provider about it. If you had the opportunity to choose among any of the following healthcare providers and you knew the costs would be the same to you, who would you most like to see about your neck or back pain? It's kind of a mouthful. This is a self-administered survey, so people read through it and probably read through this particular question a couple of times, but we had very consistent data this year as last year on this question. And we presented them with options like my medical doctor, chiropractor, physical therapist, massage therapist, acupuncturist, and then we had kind of a catch-all option of someone else, some other provider. And the data looked just like last year, where medical doctors are chosen by just over half of the US population as the person they would most like to see. And in the question, we try to remove the cost barrier, and we try to make it if you had the opportunity. So we try to remove some of those knowledge barriers as well. Who in your mind would you most like to see if you had significant neck or back pain? So just over half picked the medical doctor, 28% picked chiropractors. Just like last year, the numbers are within 1 point. But what's interesting to me is far more are selecting their chiropractor or the medical doctor over the massage therapist, the physical therapist, acupuncturist, 1% I think, so it's not even on the slide, and then a few people picked somebody else. So this is, I think, really telling, because last year, I'll tell you this year's number in a minute, but last year we found out that it was about 14% of adults in the US who go to a chiropractor in a given year as a patient. This is twice as many who are actually going, saying, well, I'd most like to see this group if I had this kind of pain. So it's a bit forward looking, because we know that unfortunately, many adults in the US will experience significant back or neck pain in their lifetime. We know that. So this points to who they would most like to see. So once people go to a chiropractor, even if it was a long time ago, their preferences change a little bit. You would expect that. But what's interesting to see is once people go to a chiropractor, they're just as likely to say, a chiropractor would be my first choice to see about this kind of pain versus a medical doctor. And those are the green bars. The green bars represent people who have been to a chiropractor and who they said was their first choice for care. So 41%. If you've never been to a chiropractor, there's a bigger difference there, and of course, in who you want to see. And there is an interesting age effect as well. Young people, who I've already mentioned today, are a bit less impressed with prescription pain medication, if you will, as a treatment option. They're also more likely to select a chiropractor as their first choice for care. A few more pick medical doctor. There's about a 12-point difference there. So they are more likely to pick the medical doctor, but they're more likely than older Americans to say that chiropractor would be their first choice. And there is a little bit of a pulling away once we reach that 65 and older group on whether they would like to see a chiropractor or a medical doctor or someone else for care. And the reasons behind this are pretty interesting. I think all those will actually come up in a minute, so I'll save that. The next question we asked people was, okay, you've told us kind of your preference. Well, now we want to know, supposing you were to experience neck or back pain and wanted to see a healthcare professional about it, how likely would you be to see a chiropractor if you had neck or back pain? So this is just about chiropractic now, and again, this is asked of everybody. What we found is that more than half of adults in the US say that they would be likely to see a chiropractor if they had significant neck or back pain, more than half. So again, this is a bit forward thinking, at least in my interpretation of the data, which is a much larger percentage than those who are going to a chiropractor today. And if you look at the far left with the box, these are people who've never been to a chiropractor. Even among this group, 38% of them say they'd be likely to see a chiropractor if they did have neck or back pain. And there are more people in that group that are younger anyway, so they may have just not experienced that kind of pain yet. But they definitely have, in general, a positive perception of chiropractic care. So they're likely to go in the future. For those adults that said, I'm unlikely to see a chiropractor under that situation at least, if I had neck or back pain, we wanted to know why. So we listed out, I think, 10 different potential reasons, and we asked, and then we included a catch-all reason of some other reason on the bottom. And we said you can select up to 3 reasons, but what's the main reason that you say you're unlikely to see a chiropractor? And what you'll notice about this data is there's not one overwhelming reason, which in some sense would be nice if there was, because as the profession you would know, okay, that's what we need to address, that issue. There's actually quite a variety of reasons that varies for different types of people. So the number one reason that people selected, and only a third of them selected it, was that they have another healthcare provider they would go to. And I can tell you a large portion of people who selected this option are age 65 and older. And so they're also often dealing with other issues like Medicare and what's available to them and who have they been seeing during their lifetime. They probably have a routine already. So a third overall adults, and this is just people who said that they'd be unlikely to see a chiropractor. So we're already talking about less than half of the adult population, and now it's only a third of them. So these numbers actually represent anywhere between 10 to 15% of all US adults. So keep that in mind as you see these numbers. The second most often selected reason was I don't trust chiropractors. And this is coming from about 10% of adults in the US selected this reason. And that 10% of people, again, that are more negative about chiropractic. But sometimes, this is a pretty strong statement to make, I don't trust. So this is not necessarily, I'm unsure about it. This is actually people saying this is the reason, representing about 1 in 10 adults in the US. The next reasons was I don't think chiropractic care is safe. And I just want to restate one of the biggest findings from last year is when people understand the training required to become a chiropractor, they don't have these fears. So I think if we were to have asked that question again this year, we could have done some interesting analysis and found out, okay, is this coming from a place that people don't understand the extent of the training or not? And I suggest that that is what we would find for some of them. There were some other reasons we gave people that I'll put up on the screen and leave there a minute, but I don't want to spend time going through all of them because there's a lot more data. But I do want to point out the one on the very bottom. Chiropractic care is expensive, is too expensive. One of the things I heard from your very smart trustees when I started this project, it was cost is just an excuse. That people will say, well, I don't have the money to try chiropractic care, but we all know that people are spending money on other treatment options. They're losing money because they can't be as productive at work, or they're staying home because they have issues. So everybody's paying something for back and neck pain. So it's a matter of helping people understand the costs. And last year we learned that a lot of people just don't know what coverage they have for chiropractic care in their insurance plan. I think over half of adults in the US said, well, I don't know what's covered. And I think that knowledge could really be power for those people if they learned and realized, oh, I actually have coverage for this. Maybe I will try it. Because really, cost shouldn't be a barrier for most people to receive care. Okay. Oh, I just wanted to point out here, and I think I mentioned this earlier, but the age 65 plus people, their main reason, and these are just people who said they'd be unlikely to see a chiropractor, was really because they have another healthcare provider. Whereas with the younger audience, they were a bit more likely to mention trust or concerns about safety. And that may be coming from a place of just lack of information about the profession. So the issues, the barriers for older Americans are a little bit different or more pronounced than they are for younger Americans. All right, this was last year. This was the most fun for me to see people's reaction when we presented the data on how many adults in the US are actually seeing a chiropractor in each year. Because there was some previous statistics collected and very reputable studies about it, and the numbers appeared to be below 10%. And it was done a few years ago, and it was a different type of study. And as a lot of you know, as researchers, methodology can affect the data. Lots of things can create differences. But last year when I saw what the number was, the percent, I saw that it was higher than the other research. I was a little worried, like, oh no, did we somehow attract people that were more likely, even though we kind of hid what the purpose of the survey was from people until they got to this question. But we asked the same question on 3 or 4 separate Gallup surveys that were about other topics, but all nationally representative, and we got the same number. So I felt really confident. But I was secretly a little worried this year that we were going to get a different number and it was going to look really bad that we got a different number. So I'm happy to say this year we didn't get a different number. The number stayed very stable. And it is 15%. Last year it was 14, but again, it's within that statistical margin. So 15% of adults in the US saw a chiropractor in the last 12 months. These are adults 18 plus, so this doesn't even represent the people under 18 that are under chiropractic care as well. So using some good advice from Jim O'Connor last year, we decided to put a number to this percent and say, well, how many adults in the US does this actually represent? So the number for this year, the 15%, represents 35.5 million adults in the US are seeing a chiropractor in the last 12 months. It's a lot of people. If you look even further at people who saw a chiropractor 1 to 5 years ago, that represents another 11% of adults. So the estimate on the number of just adults in the US who see a chiropractor in the last 5 years is 62 million people. And one of the really interesting things last year was looking at who are these people? Do they come from certain type of demographic groups? Are certain people more or less likely to go? And really what we found is chiropractic is attracting people from all different types of groups, different education levels, socioeconomic status, genders, ages, regions. So there was definitely this, again, it's a good problem to have in the sense that the chiropractic profession is attracting different types of people. It's not systematically excluding anybody, but there's also, of course, people who aren't getting chiropractic care as well. And it's a little bit harder sometimes to identify how to reach those groups, which was one of the big advantages of this year, for sure, was to unpack a little bit more about why people say they wouldn't go. And about 47% of adults in the US have never been to a chiropractor. And when this project started, that was me. I had never been to a chiropractor. And I was actually nervous to take on the project because I thought, are they going to expect me to know a lot? And I did some research, but I didn't have my own experience. And I didn't know a lot about chiropractic care. And I had one particularly influential person in my life that had a negative perception of chiropractors. So it wasn't something I ever considered, even after I had an issue that I know now would have been helped a lot by a chiropractor. And I had many people in my life who had positive experiences and had encouraged me to go. But through the course of this project, I replaced that uncertainty about chiropractic care with knowledge and education about the training, about the effectiveness of it, and have since been to a chiropractor many times, and they've helped address this issue I had for 13 years that wasn't helped with pain medication or physical therapy. So I'm personally very grateful for this project for giving me that opportunity. One notable thing about people who go to chiropractors are that young people are less likely to have been to a chiropractor yet. And I say yet because they're more likely to tell us that they will in the future if they have a back or neck pain. So in this case, about 58% of people under 40 just haven't been yet. However, to reiterate, those who have gone in the last year, Americans who've gone in the last year, are just as likely to be young as they are to be old. So it's more the difference in people who have gone more than a year from now. And they just haven't lived as long and maybe not as had issues that they were ready to address with chiropractic care. Okay, now we're getting into a really rich part of this data this year. And this is where we surveyed chiropractic users about their experiences. And for this, we really dove deep, and we invested quite a bit of the time on the survey for asking people about their experiences with their chiropractor, positive and negative. And there's a lot of, I think, very useful information for current practitioners and future practitioners. So we asked people to evaluate not only how effective was the overall care you received, but also several statements about the care. So, and this was on an agreement scale, strongly agree to strongly disagree. The quality of a chiropractic care I received is a good value for the money. That's an important one, especially if people use costs as an excuse. Patients are saying it's a good value for the money. That's a pretty good selling point. So we'll find out if they are. They are saying that. My chiropractor takes the time to educate me about various treatment options available. This is a biggie. I'm excited to get to that data. I feel like my chiropractor really cares about me. This also is particularly important to the patient experience, it turns out. And then whether patients are recommending chiropractic care to friends and family. That's an outcome every chiropractor wants, right, is for patients to go out and recommend chiropractic care. So we're going to unpack that data a little bit to learn to what extent that's happening and what drives that behavior, that recommending. And then I would like my chiropractor to work closely with my other doctors to collaborate on my health care. We'll find out whether patients feel that way or not. The first piece of good news, if you look all the way to the left, that green bar, 2/3 of adults who saw a chiropractor in the last 5 years described the care as very effective. That light gray bar right next to it, those are the people that went in the last year. So it's kind of a total group in the green, and then we broke it out by past year users in the light gray and people who went 1 to 5 years ago in the dark gray. So you can see there's quite a big difference in how patients evaluate the care when they went more recently. And I think it's important to look at these differences because not only will you see this throughout this data that there's quite a gap between, while both groups are positive about their experience in general, those that went in the last year are much more positive. Of course, they've continued to go in the last year, and you would expect to see a little bit of a jump. But there could be a barrier for some of those folks that went 1 to 5 years ago. They're more likely to report negative experiences. Still, they're quite positive, but in general, more likely to report that. On the far right, those are the people who said it's not very effective. Only 4% of people who went in the last year, compared to 17% among those that went 1 to 5 years ago. And there could be lots of reasons for this group. I always look at data and want to know more than what we know. Could we call these people up and find out? And it could be that they stopped going. That they went once, they wanted there to be a miracle cure, and they just stopped going. So it's really hard to know where the experiences are that these people had. So I won't speculate. So I'm going to move through the next 4 or 5 questions somewhat quickly. Simply because we will be putting out a report in 2 weeks. You can dig into it deeper, and I want to make sure I have time to get to the last section. So about 8 in 10 patients, and these are people who saw a chiropractor in the last 5 years, agree, either strongly or somewhat, that the quality of care they received was a good value for the money. So that's 63% and 18%. If you look just at people, the arrow is pointing to them, that went to the chiropractor in the last 12 months, it's significantly higher, not only strongly agreeing that the quality of care they received was a good value for the money, but also agreeing. And that represents 88% of adults who saw a chiropractor in the last 12 months. I would be shocked to see this same data about other things in healthcare. And I can probably go and try to find some of that data, but 88% of patients are agreeing with this statement. And this is a time where a lot of people's budgets are quite tight. So a solid majority, a strong majority of patients are seeing the value for what they're paying for the quality of care they're getting. Most patients agree their chiropractor took the time to educate them about treatment options. Again, you see about 3 out of 4 past 5-year users agreeing with that. And you'll notice that quite a few people are kind of neutral. You don't see a lot of patients giving an outright negative view on a lot of these things. But again, you'll notice an increase for people who went in the last 12 months. You see about 82% of them are either strongly or somewhat agreeing that their chiropractor took the time to educate them. So it's interesting that people that went more than a year ago, 1 to 5 years ago, are less likely to say their chiropractor took time. Now, it could be a recall issue, but you do notice a trend here that group in general will be a little less enthusiastic or positive about their experience. 8 in 10 of past 5-year users agree that their chiropractor really cares about them. This is interesting data to me because at Gallup we do a lot of research about the importance of the relationship that somebody has between whether it's their manager, their boss, their doctor, their chiropractor, anything like that. So there's a lot of things that tie to this in the data, this particular experience for patients. So in this case we have 8 out of 10 patients who went in the last 5 years agreeing that their chiropractor cared about them, and it goes up to 87% among those who went in the last year. We'll get back to that question in a minute. Something quite interesting is adults 65 or older who've been to a chiropractor in the last 5 years are more likely to perceive that their chiropractor really cares about them. They're also less likely to report some of the negative experiences that I'll show you in a minute. So in general, those that over 65 who are going to a chiropractor are reporting even more positive experiences than younger adults. 8 out of 10 chiropractic patients from the last 5 years are recommending chiropractic care to friends and family. And it goes up to 89% among people who went to a chiropractor in the last 12 months are agreeing that they recommend chiropractic care. I don't think I know a person in my life that goes to a chiropractor that doesn't recommend it to people. I have yet to meet a person like that in my own life. So I think when people go, they experience the effectiveness of it and they're more vocal about it. And the data certainly bears this out. Okay, these next couple of slides, I'll try to explain them as simply as I can. But one of the things we wanted to do is understand there's a couple of these questions that are really under the control of the profession. So beyond providing effective care and dealing with the person's pain, the chiropractor has choices to make about how much time they spend educating their patients about different treatment options, and whether the patients perceive the chiropractor cares is in large part how that chiropractor approaches the patient relationship. So one of the things I wanted to understand is how are those two experiences, whether my chiropractor cares, whether they took time to educate me, how are those related to then people going out and recommending chiropractic care? Because that's the outcome that all of you want, is for people to recommend care. So how does your approach to your patients in educating and showing you care affect the likelihood that someone will go out and recommend chiropractic care? So what this first slide shows is that the only people in this slide are people who strongly agree that they recommend chiropractic care. So these are your strongest ambassadors of the profession that are on this slide, represented in this slide. And if they also, so they already strongly agree they recommend, among those who strongly agree that they recommend chiropractic care, if they strongly agree their chiropractor took the time to educate them, they're 16 times more likely to say that than someone who doesn't feel that way. And similarly, among those that say, my chiropractor really cares about me, they are 40 times more likely to be somebody who recommends chiropractic care to others. That's what's being displayed in this data. So there's a huge outcome there for patients who feel like you care and you're taking the time to educate them. And then lastly, on this particular series of questions, many patients do want their chiropractor to collaborate with their other doctors on care. This is only representative of about 72% of patients who went in the last 5 years will say this. And there's not much of a difference on this one, whether they've gone in the last year or 1 to 5 years. So it is something that a solid majority of patients would say that they support. Then we asked people about some specific negative experiences. And this is really the last group of questions that we asked our chiropractic patients about. And here we wanted to get a sense of how often certain things were happening. So what we asked them about was, how often have you experienced any of the following? Pressure to get more services than you want, pressure to have more appointments than you want. We were very intentional about selecting the word pressure because there's a negative connotation. It wasn't just they recommend more than I want, they suggest more. It was you feel pressure, you feel this negative thing. How often do you experience treatment methods that you're uncomfortable with? Unexpected costs for treatment? Diagnosis and treatment that were different from your expectations? So the next slide, I'm going to show you what percentage of chiropractic patients in the last 5 years say they experience these negative things either very often or somewhat often. So on the left, about 1 in 4 past 5-year patients say that they either very often or somewhat often experience pressure to have more appointments than they want. 17% experience pressure to have more services than they want. And you can see the data on the other options down there. So this is not something that people are reporting in a widespread way. Certainly not, but definitely significant, I think, to note that pressure for more appointments, pressure for additional treatments is something that people are more likely to report. And less likely really to mention unexpected costs, which again, I think the cost thing is not as big of an issue. Older patients, I mentioned this earlier, they're less likely to experience these negative things. These are the percent in each age group that never experience any of the 3 things mentioned here. So you can see it's a pretty large percentage among the age 65 plus. And interesting, just over half of patients under 40 say they experience that pressure for more appointments. And I lied, there's one more question we asked our patients, which was, what services do you want to receive when you go to the chiropractor? Not surprisingly, spinal manipulation and adjustment is what 91% said. I was surprised this wasn't higher, actually. 91% said, I want that service. 81% said manipulation or adjustment of other joints. And then about 3 out of 4 past 5-year patients said rehabilitative exercise, therapeutic massage. About 2/3 want advice on how to be healthy. Keep this number in mind as I get to a couple of other things. 65% said heat and ice therapy. 55% want fitness and exercise planning. So 68% said, sure, give me advice on how to be healthy. Only 55% want an actual fitness or exercise plan. And far fewer say, I want diet and nutrition planning, 30%. So while patients in general like the idea of advice on how to be healthy, they're less enthusiastic about the plan for whatever reason. Probably the gets a little more serious at that point, I guess, for them. And we also asked them, well, what's the most important service that you want to get? And spinal manipulation and manipulation or adjustment of joints were the top two on that. Okay, now I'm getting back to what I started with. And this was back pain in the US and how many people are experiencing it. And I promised to show you how many of them went to a chiropractor. So here's the 25% in the green of people who had significant enough back and neck pain in the last 12 months that they saw a healthcare professional about it. Okay, so how many of them actually went to see a chiropractor in the last 12 months while they were dealing with this issue? Because that's really your strongest potential, as I've said, for patients, is this group of people, this 1 in 4 adults. So this circle now just represents that group. People who had significant enough back and neck pain in the last 12 months that they saw a healthcare provider about it. That bottom number, 45% of this group saw a chiropractor in the last 12 months. So while looking at 15% of adults overall see a chiropractor in the last year, when it really comes to this key group that would most likely be thinking about going to a chiropractor, getting treatment in some way, almost half of them are seeing a chiropractor. And interestingly, only 26% of them would say, well, I've never been to a chiropractor. So you have about 3 out of 4 of them that has experienced chiropractic care at some point in their lives. And just to kind of bring that last point home, that green group on both sides represents people who've had significant back or neck pain. 71% of that group has been to a chiropractor before. If you've not experienced that back or neck pain, that's the dark gray group, only 19% of that group has been to a chiropractor. So again, capturing 7 out of 10 of people in that group. Now I want to focus on this group that says, I've never had back pain. I want to know how likely that group is to see a chiropractor if they do. And that's where we kind of started the presentation. So among this group, we find out that nearly half of adults who have never had significant neck or back pain say they're likely to see a chiropractor if they do. So this is kind of forward thinking again. If and when the people experience this, over half of them say they'll see a chiropractor. Only 3% of people who saw a chiropractor in the last 12 months say they're unlikely to go back. They've represented obviously a very small portion of chiropractic patients, but you'll always have some percent that go and say, I'm unlikely to go back. So we looked at just this group in the data and said, well, what reasons is just this group giving for saying they wouldn't go back to a chiropractor? These are people who went in the last year and now tell us they're not going back. This is what they told us. A third of that group, just that group, said the reason they wouldn't go back is chiropractic care requires too many visits. And that's the biggest reason by far. But 23% of that group mentioned trust, 21% mentioned safety, or that they have another healthcare provider they would go to, and then some other reason. What I think is interesting about this is that if the number of visits is what's getting to people, did they have an appropriate expectation going in? So the first thing my chiropractor did on my very first appointment was take the time to educate me about my treatment options and help me understand the treatment plan. So I didn't expect this to be something that I could go in for a week and never come back. So I really feel that education is important for patients to understand what's expected. This is my last substantive slide. I really wanted to help. I'm not a chiropractor. I'm a researcher on primarily surveys on a lot of topics. But I really felt like there were certain things that jumped out to me that I would now recommend to you as chiropractors for how can you use this data to improve patient experience and attract new patients. And these are the things that stood out to me. Show patients you care. Patients who feel their chiropractor cares are much, much more likely to go out and recommend chiropractic care. And you have control over this. You may not have control over what issues they come in with that they're dealing with physically. You can do your part to help treat them. You can heal them, and I'm sure that goes a long way. But they might go home and have very bad behaviors and hurt themselves again, and you can't do anything about that. But you can do something about showing them that you care. Recommend, but don't pressure, that patients have additional appointments and services. So it's all about the style and the approach. And I think it's interesting that older patients are less likely to feel this pressure. Is it because they're perhaps treated differently by chiropractors? Is it because they've lived long enough that nobody can pressure them about anything? I don't know. But younger people who right now are really the greatest potential for the future of the profession, is how do we get younger people in the door earlier and keep them coming back, to make sure it's a recommendation. But I think tied to that is also setting expectations from the start. And as their care evolves, resetting those expectations and saying, I think you'll probably need to come in about this many times, and making sure that they do understand your perspective as the expert on the care that they're receiving. And then educate patients about treatment options to also avoid unexpected treatments or treatments they may be uncomfortable with, because this was mentioned as a reason by some patients as well, as a reason why they might not, or things that they have experienced. So I really think this is the takeaway message for the profession and how you can take this data now and use it. We have the opportunity in 2 weeks to publicly release this data. So I was excited to present it to you today as kind of a preview. If you want to be alerted when the report is released so that you can take it and look at it more in depth, this is the website that you can go to now and sign up to be alerted. And Palmer College will send you an email, I'm assuming, and let you know when that report is released. And we'll also have a Gallup.com article that will be available that day. So thank you very much for your time. We appreciate it.